My name is Pavan Joshi, and I am a consultant psychiatrist. I always wanted to become a doctor because my dad is a doctor. So I was quite motivated seeing him as a medical doctor. But I didn't know I wanted to become a psychiatrist until my brother had a severe mental illness. And in India, I remember spending time with him in the hospital because in India, what happens is that you stay with your carer, there is not as much staff. So one of the family members stays in the hospital with your patient. And I was 16, 17 at the time. And I would be in the hospital supporting my family in his care. And then when I went on to do my rotation for medical specialties, it became obvious that my heart was always in psychiatry. So that's how the journey began. So I grew up in a very cultural, historical city called Jaipur or Pink City. Um, it's a really lovely city and very popular for its tourist kind of destination because of it's a melting point of beautiful architecture, amazing heritage, lots of culture and diversity. So it's called Jaipur and Pink City from Rajasthan in India. Every time a person comes back um, having experienced um, freedom, freedom from the pain and suffering from mental illness. Um, every time they share their success, what they have achieved in small success in relationships to bigger success in their work, in quality of their lives, or in their personal relationships. Each one of those is very rewarding. We know mental health problems have experienced a stigma in the history. So the stigma follows the mental ill health, and it has come to psychiatry as well. I remember when I told my friends who were also medical students that I want to become a psychiatrist, people were not only not impressed, they were actually surprised and at times actually made jokes around it. But this is because the stigma the specialization has experienced. But there are other challenges as well. Psychiatry works with in many areas where people have experienced challenges in terms of social deprivation, poverty, access to the right health and well-being support affects their cognitions, which means making them vulnerable to get the right support and benefits as well. So many things related to external factors as well as some internal challenges for a specialization. But one thing I want to end it with as well, it's one of the most rewarding job. I wouldn't change it for anything. Is some of the things we mentioned already. The amount of the courage and vulnerability people bring in the consultation room and the journey they take is so rewarding to be part of that journey.